now to the other big story we are tracking. The last 3 years, we all know, have been tough for all of us, but it's been toughest for doctors and nurses around the world. They've had to work day in and day out during the COVID-19 pandemic. And how does society pay them? Sometimes with violence and insults. Throughout the pandemic, we saw instances of doctors being physically attacked and verbally abused in India. Now, a team of resident doctors in Delhi have decided enough is enough. They have written a letter to senior officials at the Health Ministry. And what is their demand? They want the deployment of the CRPF and CISF at hospitals. Essentially, they want the CRPF and the CISF to guard hospitals. Now, the letter follows a recent order by the Health Ministry to remove private security and bouncers from the Lady Hardinge Medical College in Delhi. But without the security, doctors feel, well, that they will be unsafe and at the mercy of patients' relatives. We'll quickly get in our guests who are joining us this evening. Dr. Sabyasachi Mandal is the president of the RDA Lady Hardinge Medical College. Dr. Sabyasachi, good to have you here. Dr. Rohan Krishna is president of the Doctors Association, and Puran Chand Arya is a former CISF soldier. He's the founder of the Ardh Sainik Welfare Board as well. Dr. Mandal, I want to ask you why you think that the CISF and the CRPF need to come and guard medical colleges and hospitals in this country. Isn't that a bit extreme?
Thank you for the opportunity for talking about this matter. I must say the violence against doctors is in rise in India. So it's happened in multiple states, and our college is not an exception. Okay, so recently the order came from the ministry to remove this private security from the it's ministerial decision, but we need security. Doctors need more and more security because we work in very sensitive areas. We work in emergencies and different kind of wards and OPDs, and sometimes the crowd is huge, and any single thing can spark an incident. So doctors are really vulnerable. And if you see in the previous years, in different states, multiple cases of violence occurred against doctors. Even in our college, there is an incident in last February. So doctors need to feel more and more safe. That is why we are demanding this kind of action.
Dr. Rohan Krishnan, please help me understand if that is how all resident doctors feel, because I mean, why is the police not enough? Why is private security not enough? There are some 542, medical colleges in this country and 62 standalone PG institutes. How is it possible for the CRPF and the CISF to give security to all of them? They have other things to do.
Obviously, it is not possible for the CRPF and CISF to give security to all the medical colleges. But we have to see that despite what you are saying, that there are private security agencies and police, the number of violence against doctors is not going down per se. And secondly, if you see recently, this issue has raised because recently our Honorable Health Minister, Dr. Mansukh Mandaviya, cancelled the marshals who were employed to Lady Hardinge Medical College without any prior notice or decision. Just one day before the order came that from tomorrow onwards, there will be no marshals deployed to the medical college. Now, if you'll see, when you are talking about 500 medical colleges, first we'll have to divide into two parts. One is a government medical college and a private medical college. So automatically half of the band will disappear because of the government medical college. If you want to enter into a railway station, an airport, anywhere in this country, even a temple, there are some rules and regulation. There is some ticketing. There are various kinds of shenanigans. But when it comes to a hospital, that to a government hospital in Delhi, everyone can enter it. So we are not scared of the patients. There is a mindset that doctors think that patients will harm us. There are certain goons of the society. There are certain gundas of the society, certain political people, certain middlemen, certain brokers who wants private nursing home to run. They want that there should be a hatred among the patients and the relatives against the government doctors. And that is the maximum strength and the load that the government doctor, especially the resident doctors, are facing. And when we talk about a state like Delhi, I think that the protection of the doctors that too working in a government setup, when we did not bother that how many patients or COVID patients are coming, or who is dying of our relatives of COVID, and who is catching COVID because of us. When at that time ministry invoked a law where violence against doctors was taken seriously, that was a non-bailable offense. So we want something like that, a concrete measure.
Correct.
So that we feel safe and secure in our working environment. And I think that's our basic right.
But is asking for CISF and CRPF to come in and guard all hospitals, is that even practical? Puran Chandra Arya-ji, look, the doctors may have a point. Why should, the CISF, for example, if they can guard temples and if they can guard airports, why can they not guard hospitals? After all, can only VIPs and VVIPs in this country get security? The doctors are facing violence. They are facing violence almost every day. Not all doctors, but some of them do face violence. And maybe when you see people in uniform, there is a certain deterrence. Therefore, deploy the CISF and the CRPF. Is it practical?
Thanks for giving me opportunity. I'm from CRPF, as I just At present, I don't think there's a such critical or such horrible situation to put the CRP or CISF for hospitals, because I feel personally, doctors' community is very respectable and honorable for the entire nation. I personally say I have 5 doctors in my family. And on the security of a doctor, so I'm talking about my family protection also. But CRPF, CISF, a huge trained soldier, if we are going to deploy in the hospitals for the medical doctor security, it is a good idea, but practically I think it is not feasible. Moreover, why the government has removed the marshals from hospital, there should be some other reason. Maybe that security may be not reliable. I'm sure there should be much reason behind that. Further, trained soldiers who are able to run with the soldiers, enemy, and I don't think they need to put in such very good hospitals and respectable, honorable doctors. They can, I think the private security agencies are very experts now, and they can go in a right way and they can get the services. I also surprised why the marshals was removed by the honorable minister, but I think need to see in that matter. But CRP, CISF directly deploying for the hospitals protection or medical cadre protection will be really, it is a very challenging for the government. But on the same line, it is a one good news I would like to share here. Okay. There is a proposal of the government. CISF is being deployed, is being authorized or being just proposed to put in the private or Sarkari or any other institution. Those who want to take the CISF security in near future, this proposal is under consideration. Yeah.
Okay, before I end this discussion, thank you very much, Dr. Rohan Krishnan. You've heard from Puran Chandra. The proposal is simply not practical. I mean, if you require the security, ask the state police, ask the city police, and ask the, ask private security guards to guard hospitals.
See, obviously, the private
one thing I want to say, CRP, CISF...
Just a minute, Mr. Arya. Go ahead.
Yeah.
Yeah, see, what
are you saying, Mr. Arya? CISF and CRPF? Just a minute. Mr. Arya, please make the point you're making. Okay, I think Mr. Arya is not being able to hear me. Dr. Krishna, quickly, just respond to what Mr. Arya is saying, that it's simply not practical.
So the problem is that we want safety and security at any cost. When we are not feeling safe with the environment with private security guards, and the people, the gundas, they are not respecting the private security guards. Recently, an order was issued by AIMS director that no private security guard will bring food and will not bring chais and samosa. Actually, the private security guards are doing that work only because nobody is taking them seriously. there are many lapses in the selection of private security guards, and if the people are not fearing them, then what is the point of having such security guards? I think that even 4 or 5 CISF per hospital, especially in severely affected hospital with patient load like Safdarjung Hospital, AIMS, Lady Hardinge, in such hospital, even if 5 people are employed, I think that it will make a difference to the mindset of the people, that suddenly some serious consequences will be faced to those who are trying to create a nuisance and who are trying to disturb the piousness of the medical system and of the hospital.
Okay, Dr. Sabyasachi, Dr. Rohan Krishnan, and Puran Chandaria, thank you very much for joining us. Finally, as we end,